Hi, I'm Dr. Brian Thornburg, and a mom asked a question about the importance of taking the Prevnar 20 vaccine to help prevent ear infections in her 2-year-old child. The child's having recurrent ear infections, and the pediatrician is really pushing the Prevnar vaccine. And mom asked me if this would help. So, a little history on ear infections. Prior to the Prevnar vaccine coming out in 2000, strep pneumo was the primary cause of ear infections. The first version of Prevnar, Prevnar 7, had very low effect on the incidence of ear infections. Then we went to Prevnar 13, and now we're currently on Prevnar 20. The 7, 13, and 20 mean the different number of serotypes or different strains of strep pneumo that are contained inside of the vaccine. The 13 and the 20 both resulted in a decrease in the incidence of strep pneumo ear infections, the 20 being more effective than the 13. So the incidence decreased from 25 to 50% of ear infections prior to 2000 to 15 to 30% of ear infections being caused by strep pneumo. And I call this the whack-a-mole. If we're taking down strep pneumo, other viruses, other bacteria will then take its place because life is dynamic. And so if you pull one weed, another weed's going to pop up in its place. So life just doesn't stop because we have a vaccine. Other things are now taking its place. So now H flu, which we have a vaccine for, is now the predominant cause of middle ear infections, accounting for 30 to 50% of all ear infections. To answer the mom's question, taking Prevnar 13 or Prevnar 20 will help decrease the incidence of strep pneumo ear infections, which account for 15 to 30% of bacterial ear infections. However, they don't stop the incidence of infections. There's another 85 to 70% causes from other bacteria or viruses. I don't give this vaccine to my kids. I really focus more on diet. I focus on good sleep. I focus on good eating, good exercise, hydration. But again, I didn't have a child with recurrent ear infection, so I didn't have to face that immediate issue. Here in my own practice, I always focus on kind of the more lifestyle factors that help reduce ear infections.